Hello?
You ready over there? Go ahead and call the meeting to order. Roll call. Cindy,
Here.
Marlene is absent. Heather, absent. Joe,
Here.
Jim,
Here.
Kim,
Here.
and myself, present. Jared. Approval of the agenda.
I move we approve the agenda.
I will second it.
All in favor?
Aye.
Aye.
Approval of board minutes from March 27, 2025.
Joe, I make a motion that we approve the board minutes from March 27th, 2025.
Can I second that?
All in favor?
Aye.
Aye.
Do I have any visitors' comments?
Hi, Katie Homeland. I'm the Youth Programs Development and Advocacy Coordinator. And I know Wellness does our report out next month, but we have a couple exciting things that I think warrant a little visitor comment. The first is that we have our info session tomorrow night at 6 o'clock in the Dorothy Engel Conference Room, where we'll be covering all of our summer camp programming. The team and I have built over 1,200 hours worth of summer camp opportunities for kids. So there will be a lot happening, and that's open to the community, our current families, people who are interested, or just community members who are curious what we're up to this summer. So 6 o'clock, Dorothy Engel Conference Room. Come with your questions. I'll also be at the Early Childhood Fair if you're unable to make it tomorrow night. And then the other really exciting thing is that Kylie Watkins was awarded the After School Superhero Award this year. She's one of 5 in our state, which I think is just a huge testament to, number one, who Kylie is as a person, but also the incredible work she's doing with our kids here, and both with youth programs at PMC, but also in her other roles as a dance instructor and her other service around our community. So I just wanted to give her a little bit of an acknowledgement and thank her for all of her hard work and the tremendous impact she has. So, thank you.
Thank you. Any other visitor comments? Board member comments? Okay, committee reports, resource.
This is Cindy. Joel led the review of the financials for this resource committee meeting, noting that March was a strong month. Lab numbers were down, but this was not a health fair year, so that influences numbers. Rehab, physical therapy, and ER numbers have been consistent, and we're also averaging about 14 patients in long-term care. We may owe some future payments to Medicare to reconcile accounts, but even so, our income statement is strong with addition of 340B revenue that provides rebates to the hospital. There was a cash drop on our balance sheet, and this reflects what we finally can start paying into the PERS system to catch up after the state resolved their technical issues. But overall, our operating margin is strong. And as far as investments, we invest relatively conservatively, and we're keeping an eye on things, as I'm sure everybody else is as well. For our outstanding grants, we did see one pullback, but due to Sarah's work on this, we don't think we'll need to refund anything. Katie, our grant specialist, reported 2 small grants came through and we're holding on the rest. And it was also noted that Representative Begich took over a $3 million in CDS, which is new facility phase 3 cost funding from Senator Murkowski. And a decision on that grant is expected in 2026. And the work building will be open in a couple months, at which time we'll finish paying those bills and exhaust $2 million of the grant funds from HRSA. We have some funds to harden the new hospital site, and we'll continue to do some of that work. And Joel reported that he was able to attend a conference for training, for which AHA paid the expenses. And Phil will be heading to DC soon, and next month we will have a budget presentation.
Any questions on that? Thank you, Cindy. LTC.
Arlene.
Marlene, okay. Infection control?
Yeah, this is Joe. I went to the infection prevention control meeting on April 16th. We received a public health update from the public health nurse. Talked about changing recommendations for HIV to better align with CDC recommendations. Measles was discussed. Measles is on the rise nationwide. The committee discussed what ifs for treatment of measles if there's an outbreak in Petersburg. Also, we talked about RSV boosters. They are continuing. Minutes from the last infection control meeting in February were approved. The infection control coordinator discussed potential allergens in the building. There's a lot of discussion on plumbing and waste mitigation. The details of which are probably not fit for primetime radio, but suffice to say that the plumbing is a major issue in the building. Environmental care rounds report was discussed. We went through some of the action items, review of cleaning projects and cleaning chemicals was discussed and that action item was closed out. 2 other action items for antibiotic stewardship and salon chair are ongoing. The head of the laboratory talked about water testing in the facility. It's been done throughout the facility and there have been no issues. Also talked about some respiratory illness circulation in the community, and that also the head of the lab discussed blood cultures, and they have been good. There haven't been contaminations of those, so they're getting good samples there. As far as hand hygiene, that was also discussed. The clinic is going to hand out hand hygiene surveys. And lastly, we got a vaccine update and was told that the COVID vaccination rates remain very low. all I got.
Any questions for Joe? Thank you, Joe, for that report. Moving on to reports, rehab. Did anyone have any questions regarding the report by Brenna? Thank you for that report, Brenna. We'll move on to plant maintenance. Did people have any comments regarding Wolf's report?
Yeah, this is Joe. I just have one question. You know, Wolf, you mentioned in your report there that, that this, replacement of some of the plumbing parts is gonna require shutting off water to the hospital. And it was gonna be done at night and there, everything would have to kind of be set up well in advance for that. Do you, at this time, have any idea when that might occur?
Hi there, this is Wolf Brooks with Plant Maintenance. So right now, our last holdup was actually sourcing a piece of copper that was suitable for replacing the 6-inch main on the sprinkler. And once that gets here, we're going to be able to actually create a plan. I just don't know when that is yet. We had a bit of an issue with tariffs and stuff like that, but now that it's finally supposedly on its way, we should be able to kind of get a date set and go from there.
Okay, yeah, and I think I remember from some of the committee discussions too, it sounds like there's gonna have to be like additional plumbers on hand, just to kind of cover any contingencies that may occur
Yes.
when the water's shut off.
Per codes, yeah, with anything regarding sprinklers, we need to have a certified plumber there. So for that, we're going with Chris with Absolute Drains. He's been great to work with for pre-planning and more or less knowing everything that we'll need. So, and also we are flying in a secondary person that he knows so that we can ensure that we get this done that night and we don't have any issues.
All right, thank you.
I have a question.
Yeah, go ahead, Jim.
About how long do you expect to be shut down?
Right now, we're hoping for 6 hours.
Okay,
And during that, every 30 minutes, we'll need a fire watch since we're shutting off the water for the sprinkler system. There's quite a bit that goes into this, but yes, so right now we're hoping for 6 hours.
okay. Thank you.
Yep.
So I guess I have a question regarding if we have and I'll use the word a catastrophic failure of the system, do we have a plan and whatnot for, I mean, I'm assuming it would take part of Public Works plus yourself to clean something like this up. But is there a kind of a plan and do we have the logistical stuff we need in place to implement that plan, knowing that this may be a very high possibility?
Yeah, so we actually, and this is part of what I've been doing with Chris, is we're kind of going through almost every single scenario that we can think of, and even some that we are just kind of making sure that we're prepared for, even though it's not very likely. As of right now, I do not see that there is a possibility that we're kind of missing something for this. In my report, I know that the main shut off for the building, it was kind of, we were told by Public Works that it could fail, in which case that will be something that they'll need to replace. So if it's something inside the building, then we'll have, I mean, secondaries, even 3 times things for rebuilding, like our backflow preventer, stuff like that. And that, the domestic water supply, I think in my report, that was our biggest concern. It's not actually the piece that failed. And for that, I do have the backflow preventer plus 2 rebuild kits in case there's any issues with sediment that breaks loose, things like that. And we're planning on draining the entire system up until that point to make sure that any loose kind of sediment is out before we actually turn the water back on. And we're currently in the process of writing up a full plan of action and how we're going to go about this, which we can make public and kind of let people know what our plans are. And if, you know, kind of an if-then, if something happens, then we're going to do this. So
that's where we're at right now.
Any other questions for Wolf? Thank you, Wolf, for
Yes.
that report and the explanation. Environmental Services, any questions on Brazel's report? None, thank you for that report, Brazel. Home Health. Question on Laura's report. Seeing none, thank you, Laura, for that report. New facility. Were there any questions regarding that report? I do appreciate the photos that are with these reports. That shows a lot. Thank you, Justin, for that report.
I actually did have one
Okay, go ahead.
question,
Cindy?
and that is on the Phase 5 wetlands permit. Is there any chance with the interruptions that have happened with some other agencies that that would be delayed?
Bill?
Mike, if you're on, you want to handle that one? As far as I know, I haven't seen anything that would indicate a delay, but if Mike is on, he can report out on that.
Yeah, hey, good evening. This is Mike Cruz. Can you hear me okay?
Yep.
Yes.
Yes.
Yeah, we've had several wetland permits that have been going through. We haven't seen too many delays. I think the timeline that Justin put in his report, that's still accurate. As of right now, we haven't been notified of any delays. It's a possibility for any of it. But at this point in time, I wouldn't expect to hear anything on a delay right now.
Moving on to Stephanie's report for quality. Thank you, Stephanie, for that report. How about infection prevention? Rachel's report. Thank you, Rachel, for that report. Everyone's getting a clean bill with after the questioning of Wolf on his. Executive summary, sir.
All right, thank you. All right, I'll do some highlights here. We went on KFSK today and we were able to talk talk about the measles update from infection preventionist Rachel Candle, which was nice to get an update on that. We're also monitoring that situation and more information as it arises. In that line, we had a presentation or a conversation that you'll hear on a community needs assessment that was completed, and Katie will provide that report, so I won't really summarize that at this point here. And then to echo Katie Homeland's comment about congratulations to Kylie for her award. That's really great. And then also the youth programs, the summer programs for wellness and Kinderskog program for the parents and kids tomorrow night at 6 p.m. in the Dorothy Engel Conference Room. I just want to make sure I got that right, so it wasn't. And then the early childhood screening or fair, I guess, at the elementary school on Saturday from 10 till noon. I'll be there for hearing, and there will be some availability there for other parts other than Katie. I'm not sure actually the whole list, but it'll be great. And then also on Saturday is our speech language pathologist. Our contractor that's been here is putting on a presentation seminar related to speech and language for kids, I think up to the age of 4.5. And she is doing that at, what was the name? Good Beginnings, yeah, thank you, at 9 o'clock to 10. So those are some highlights here, really youth-focused in the next couple of days. A few things also on the clinic, not the clinic, the patient care. It's been extremely high volume, continues to be high volume up in our acute care, inpatient, and long-term care. Probably the highest continuing amounts for our swing beds that we've seen in many years, probably, or likely. So that's certainly still tracking in that area. The clinic is also maintaining appointments, and we're still looking at access in the clinic, which is readily available. So we're looking at next available appointments in primary care is about 6 days on average, which is really good from a standardization standpoint. Within 10 days is typically is the standard, is the guidance or standard, and we're seeing quite a bit of availability within that time frame. They're also gearing up for the summertime. Summertime's always busy, and we're seeing, I think, our first cruise ship here coming in, I think this week or next week. So that always brings in some higher volumes in our facility, both ER, clinic, same day, all those kinds of things. Optometrist Dr. Kapp is here in Petersburg in April. She'll be returning here right around Mayfest, coming up also for another clinic. So she's been doing a really great rotation coming into Petersburg. So I'm hearing a lot of positive comments on that. I'm very glad to see that service here in Petersburg. Dermatologist Cameron French is scheduled, I believe, in June. I think that's firmed up, but we'll have more information on that as we get that information available. Our telepsych is seeing patients on a regular basis. I think once a month, I believe, is the schedule at this point, and that seems to be increasing in availability. Dr. Sonkus will be here in Petersburg on site, providing some training and seeing patients to our medical staff and to our staff, our community here in June as well. I provided some stats for you to review, similar to what I normally do. And from if you scroll down to the work building, gearing up on the transition is definitely top of mind for me, making sure the departments that are moving into the work building are preparing, that we're not just preparing for moving up, but looking at our workflows, what that looks like. We'll have some separation from departments, and also looking at how we can also maintain operations with those same departments in the existing facility. So it'll be a little bit challenging because of that separation until we have a new facility. So gearing up for that from that standpoint is really important. That also means cleaning out a lot of the different areas in the existing facility. So that people will move up the hill into the work building, which will also make space available down in the hospital, the main hospital as well. So meeting with departments in need, things like therapies, where we're able to expand some opportunity there, some office space for business office, those kinds of things, making sure we're occupying and maintaining that space. Public health will be up the hill, and home health will be able to move down into our campus. We're very excited about that. And a few other moves in looking at ways that we can utilize the existing space so that things aren't just shoved in hallways and vacant rooms and those things that we are struggling with currently. So there's some upside, even though it's not ideal not having the new hospital. At the same time, we'll have a dry run. I would call it a kind of a soft opening and a dry run related to both the workflow, the effort, and the lessons learned from programs moving from one place to the other. What does that mean for cleaning your space? How can we digitize some of the existing paperwork down here, so we're not bringing that stuff up the hill. So all those kinds of factors we're working on as we go forward. We're still waiting on a certificate of need. The state had a number of questions to complete that, and we're still have to resubmit that into the state to have reviewed. So we're still pending for the MRI. Otherwise, everything else is on track from the work building standpoint. I'm advocating pretty hard on funding. It's been very tough. Obviously, the state's fiscal environment's been very minimal, bare bones on the capital side. Not for lack of effort. Very grateful for the Assembly voting #1 state and federal priority. I will be in DC in a couple of weeks and with AHA and also talking about capital funding and meeting with the delegation for infrastructure. And so Senator Murkowski's appropriations, she's kind of handed those same projects off to Representative Begich, and we'll have more information, when we have a chance to meet with them. And so I'll bring that back. From the financial side, Jason will cover many of those programs, but lots of headway. I talked with Carrie Lentine today at the billing manager, bringing that in-house and seeing how it's going. Lots of positive things, lots of things that we're hoping to see on the AR days being managed and coming down, being able to work those claims. Really some solid performance, and we're moving in the right directions, it seems, from that. So cautiously very optimistic on that. It's been very busy from their side. The 340B program, which Jason has explained in the past as well, is in operation and is working well from the payment side. See anything else I need to mention? Jason will cover those. I think that's all I have at this point. We're still pending. We have some grants that we are continuing, but it's pretty dry on the new grant side. So it's a bit of a concern, especially when it comes to programs like behavioral health. How are we going to continue those programs? We lost the school-based funding that was provided through the state. So we're working with the school on how we're going to fund some of those for next year. So it's a concern. That's all I have.
I have a couple. One is, on the certificate of need, are the questions that they have fairly routine questions?
Certificate of need. Certificate of need is very challenging. I haven't gone through one of those before personally, and it seems like it's different each time, and they deny them. So I feel like the relationship with the state is good. I feel like they want us to succeed, so we have to make sure that we respond to their requests and submit. So, yeah.
And then my other question was, have we extended an invitation to Representative Begich to tour the new facility site?
Yeah, I have talked with their office. I've also reached out to our delegates if they're Mayfest to come and tour our facility as well. So, yeah. I do have one person that I know that'll be here from the state, so we'll see if they show up. But I've also extended the invitation to others. Yeah.
Any other questions for Phil? Thank you, Phil. Moving on to financials.
Good evening, everyone. Cindy did an excellent job of recapping the basics of the financial statements. I have a few additional highlights that I'll report here, but I always like to go through the statistics first. So the clinic did 750 clinic visits, down a little bit from February. A radiology procedure strong, 213. Lab tests, 1,500. That's down a little bit from the previous month. I think we probably saw a good flu bug or some COVID or something come through January, February, but it appears to be lightening up a little bit in March. Rehab services, very strong, probably related to having a strong census on the swing bed unit. Home health is doing good volumes. Emergency department, pretty standard, 60 visits. Acute care, we had 29 acute care days in the month, so about one a day. Swing bed, very strong, 133. And I did want to comment a little bit on this because it relates to another subject. So we can see year to date, we have 922 swing bed days. I was able to meet with Matt and Jill and Jennifer Briner. And this number actually breaks into two components. There's true swing bed days, but there's also patients that, we can't get them into a long-term care bed or they can't be discharged to home. And so we keep them on the swing bed unit. We call them an ICF bed. And so through the end of March, there was about 278 of these. And so that has an impact on our cost report. And I'll talk about that a little bit more, but I just wanted to kind of indicate. So for example, last year we had a lower census on the inpatient, on the long-term care unit. So we were able to get everybody in there. So we didn't have any ICF days in the previous fiscal year. This year's much busier on the long-term care, and thus the overflow ends up impacting their swing bed. And then you can see there the long-term care days, 420. Okay. So we come down and we look at our revenues, gross revenues for inpatient, outpatient, things of that nature. 2.6 million against a budget of 2.3, so about 300,000 above budget. Contractual allowances, always difficult to estimate what our impact to the cost report will be, but based upon our models so far, indicating a reasonable contractual adjustment. Prior year settlement to report this month. Next month, we will report a prior year settlement. We completed in the month of April what's called a desk review of the 2023 cost report. And due to some corrections in that cost report, PMC will be paid about $250,000, or excuse me, $450,000. So we're very delighted about that. We had anticipated paying back to Medicare because there's always usually a few claims that get processed, which it ends up being that we pay them 50, 70,000. So we'd reserved a liability of 100,000, but it turns out they're going to pay us 450. So that's a positive impact to the financial statements of $550,000. Bad debt expense, things that you see there. So our net revenue is 2 million against a budget of 1.8. Glad to start seeing the 340B will start strong and then kind of even out at a lower amount of catch-up payments that we were anticipating. They can go back a period of time and reprocess those transactions. We're delighted to see that program come into place. Great big number here. I'm not as effective as Phil is at going out and finding grant funds, but we did do our best in the finance department, and we came up with a program called the Employee Retention Tax Credit. It's a program through the pandemic, the public health emergency, COVID. We qualified for $2,933,000. And I'm going to shut my video down, see if that helps. One minute. There you go. Hopefully that helps with the transmission. So we applied for it through a firm that specializes in this process, this program. Now, the IRS is the company that, or the organization, the agency with the federal government that processes this. They're very behind. It can take upwards of 2 years for this money to be paid, but we wanted to get it recorded so that we can track it. It's in our financial statements, reflects some the improvements that we're working on in the organization. So you'll see that we have the 2.9 million, but we also have down here under some of our expenses, an increase under purchase services. That's quite high for the month, 540,000. That covers the expense that we will pay eventually to the firm that assisted us. We don't pay that now. We pay when we get paid, and so in a couple of years, but we want to record the expense and the liability It's the right thing to do for accounting. Then that will flow through our cost report. Cost report will actually reimburse us for about half of that before we actually have to pay the firm for it. The other thing about this we have not recorded is that when it's approved and paid, they will pay us interest back to calendar year 2021. And that interest that they will pay will most likely cover more than the expense of paid to the firm that assisted us in applying for this. So delighted to see that. Doesn't compare to what Phil and others came up with to build the work building, but we just wanted to do our part in the finance department. Okay. So you can see there the expenses, 2.6 million against a budget of 2, and I explained the big anomaly is that expense for the consulting fees. Investments were down a little bit, and the capital project, as per normal, giving us a whopping $4 million positive bottom line for the month, and year to date, positive bottom line of 12,862,000. Wanted to, as I referenced earlier, working on a couple things. I talked about the desk review, 450,000 we'll get from that. We're also completing what's called an interim rate review for fiscal year 2025. I anticipate that we'll have to pay about 225,000 back on that. Medicare actually paid us a couple of months ago. They paid us 200. They thought they had underpaid us thus far in the year. So they paid us 200. We put that in a liability. We did the interim rate review based upon our changes in volumes. We think that we'll have to owe that back. But what's going on is our acute care days actually are down when you factor in our observation days, which is an outpatient. They're down as compared to the prior year, but our swing beds are up. And as I indicated, there was an increase in the INF days, and those are compensated. So Medicare basically owes us $1.4 million for the decrease in days for the acute, but we owe them $1.4 million for the increase in the swing bed days. Outpatient is about normal. So overall, I calculate our cost report is pretty much break even at this point, and all we owe back is the money that they paid us a couple months ago. So good things there. As it was indicated, we're getting close to having the budget, and we look forward to having a budget meeting next month and getting it passed by the end of by May, or end of June, excuse me. Cash remains strong. We're almost caught up with all of the PERS issue. The cash line, but maybe some of these cost report settlements will boost us back up a little bit here. And we're very excited to have insourced the business office, and we'll continue to see some positive performance in that over the next 6 months. So that's the majority that I wanted to comment on. Some anomalies, some extraordinary events that happened that might not have been covered in the resource committee meeting because they happened after the meeting. Any questions on the financial report?
Thank you,
Okay,
Ted.
here we go.
Report. New business, community needs assessment.
All right, let's get this going. How is the sound and video in the room? Everything working good from an AV standpoint? And Jim and others online, you can see the slides all right and hear everything?
Yes.
Great. Okay. Well, thanks so much for giving me the opportunity to talk with you today about the work we've been doing to complete PMC's 2025 Community Health Needs Assessment. I'm going to start out by talking about why we do this and the requirements we're trying to meet through this project. If my sound starts to get awkward at all, I'll shut off the video, but let me know because sometimes I don't know if there's a delay. So please interrupt if there's any issues with the sound transmission. So completing a community health needs assessment every 3 years is an IRS requirement for nonprofit hospitals and includes adopting implementation strategies to meet the health needs that we identify. And how hospitals meet this requirement can vary, but the process needs to include input from people representing the broad community served by the hospital, specifically including those with public health expertise. So, the assessment also needs to be made widely available to the public, which we look forward to doing next month when it's final. So essentially tonight, what we're asking the board for is to consider the community health priorities that our team has identified and our recommended strategies to address those. These strategies, or a version of them that reflects your changes, would need to be approved by May 15th for us to meet our IRS requirement. So before I dive into what those priorities and strategies are, I'll very quickly walk you through the process we used for the 2025 assessment. So responding to this requirement, and also just because they are our partners in delivering healthcare in Petersburg and their knowledge is invaluable, we partnered with Aaron and Ricky from Public Health in this work. The PMC representatives included Julie, Steph, Becky, and myself. We've been meeting since last summer to look through our previous assessments and look at what other Alaskan hospitals have done to meet this requirement and plan our own approach. We looked at state and national health surveillance data as well as internal hospital data. We decided to solicit community feedback through a two-pronged process using both stakeholder interviews and a community survey. So last fall, our team conducted 19 30 to 45-minute interviews with people representing a broad range of roles and identities in the community. And while these folks will remain anonymous in the needs assessment report, I cannot say enough how grateful we all are to them for taking the time to share their experiences and their knowledge of our opportunities and barriers when it comes to healthcare. After the interviews, the folks we spoke with filled out a survey through a link that was not connected to their name. It gave us a sense of whether we were hearing broadly from people with unique vantage points when it comes to community health. And that survey is what we use to kind of give a picture of the perspectives that we're pulling into that process. Then our community survey was designed, built, and tested by our 6-person team. And then we had a final round of testing from some valiant PMC staff volunteers. They may feel they were a bit voluntold, but we appreciate them very much nonetheless, whose feedback really helped us to make sure it was in the best possible shape when we released it. We're also so grateful to Melva and Ro for their help vetting our translations into Spanish and Tagalog. The survey was available online and on paper, and the team on the ground in Petersburg did a lot of work to make sure there was comprehensive outreach and public information, letting people know what was happening. So this survey, it's not a statistically representative sample. Oh, Steph just let me know the slides aren't moving. Have you guys been looking at the same slide this whole time?
Yes.
Oh, thanks, Steph. That's not good. Just a moment. Thank goodness you told me that, Steph. Let me go back. There's a lot of information on this slide. All right, let's try this again. Oh boy. Okay. Let's see if we just share part of the screen. Maybe it will be more friendly. Or maybe if we share the whole thing, it'll be more friendly. Now, if I get rid of this, I think I lost my sound, but can you guys still hear me?
Yes, yeah, we can hear
Okay,
you.
great. And now I can hear you. And did the slide just change?
Yes.
Great. Well, here are all the slides that I've been talking through. You do have them in your packet, so hopefully you've had a chance to see them. Luckily, Steph reached out and saved me before we got to the really juicy stuff. But let's just catch up. So here's our excellent partners. Here are our planning process components. We talked through most of that, luckily. Our stakeholder interview methodology. These are in the slides as well. And then the representation of different roles in the community through our stakeholder interviews. And then moving on to the community survey and how we did the outreach and for that. And that gets us caught up to exactly where I was when Steph saved my bacon as per usual. So as I was saying, the survey is not a statistically representative sample of our community. This is not research, but we were really pleased with the increased participation over last time, the 2022 survey numbers. And we were pleased that the The respondents to our survey roughly mirrored what the US Census estimates say about our population. White people and Alaska Native people and employed people were all a little overrepresented in our survey respondents, but overall we saw a lot less skewing than might have been expected, given that it wasn't a piece of research design. Now, I'm going to run very quickly through just some of the takeaways from our look at internal data. The full report will be included in your board packets next month, and it will be available for download on PMC's website, of course. There will be plenty more to talk about then, but these are just some of our highlights. So starting just with our patients, over the 3-year period between January 1st, 2022 and December 31st, 2024, PMC served 4,598 unduplicated individual patients through 50,453 patient encounters. And you will already, as board members, be pretty familiar with these numbers. And we, again, couldn't possibly thank Matt enough for his valiant work getting us these numbers to go through. So just to name a few of the areas that you look at every month, that's over 25,000 clinic appointments, more than 66,000 lab tests, nearly 6,000 home health patient visits, and much, much more, as you can see. And of course, our amazing non-medical teams have been putting up the numbers as well. In less than 2 total years for these services, that's over 29,000 meals served, and about 3 humpback whales' weight in laundry washed. So pretty darn impressive. Looking at our patient data, and this, again, very unlikely to come as a surprise to board members, but other folks in the community may not be as familiar with some of this when they see it in the report. So hopefully it'll be useful. Most of our patients are covered by all kinds of public insurance. Oh, excuse me, most of our patients are covered by private insurance. And then almost as many over again are covered by the various types of public insurance combined. But quite a significant number of our individual patients over this 3-year period were self-pay as well. And when it comes to the volume of visits by payer source, that percentage that are self-pay really shrinks compared to the share of their individual coverage on the previous slide. And then over the last 3 years, PMC has provided over $685,000 in financial assistance to our patients. And that includes both the income-based direct assistance with healthcare costs, which any patient can apply for, as well as providing matching funds toward people's payment plans. This is some important data, especially in light of some things that come up later on that we heard from our community about things being tight right now. So now we will take a look at what the community told us through the survey and the interviews we conducted. Again, it's going to be a pretty quick summary of a lot of input that our team has been analyzing, but it will all be at your fingertips next month for your reading pleasure. So in the survey, we asked our communities to tell us the 3 most important elements of a healthy community. And the largest group agreed that access to healthcare is critical. Just about as many said good schools and childcare, as well as good jobs and a strong economy. And about a third of people who answered said safe and affordable housing is fundamental to a healthy community. No other option on this long list had more than a fifth of the people in agreement, but some of the other top answers we saw were healthy behaviors and lifestyles matter, safe and thriving childhood, access to recreational activities, safe neighborhoods, and support for adults as they get older. And then we asked people to tell us the 3 biggest health problems facing our community. It won't come as much of a surprise. Over half of all respondents chose substance use. We have seen that in prior years as well. 42% said lack of access to affordable housing is a problem for our community's health. And just about as many said that the cost or difficulty with accessing healthy, nutritious food is the top problem. And 40% told us that mental health challenges generally. A couple other top answers were chronic disease, health problems related to aging, and lack of access to healthcare. And then finally, we asked a similar question, but about safety. What are our top 3 safety problems as a community? And here we saw huge agreement, with far and away more people selecting these top 3 answers. First, misuse of alcohol with 54% selecting that, sale and use of illegal substances with 51%, and finally, misuse of prescription medications, that's your fentanyl and opioids, with 50%. I will say over 80% of the people who answered this question chose at least one of these 3 answers. And presented with 16 possible answers to choose from, plus an other option where you could write your own answer. Nothing else got even close to 25% agreement. So this was a pretty significant level of agreement from the community on safety problems having to do with substances. So there's so much more that we look forward to sharing with you. And I am going to share a few more data points, but I wanted to kind of group them within these 5 health priorities that our team identified. So these are, as you can hopefully see, first, people in this rural community need and deserve comprehensive, high quality, modern healthcare where they live. 2, our community needs support and information to effectively access the healthcare services we do have. 3, rising costs are impacting our community's capacity to get what we need to be healthy and thrive. 4, as we just discussed, behavioral health challenges, especially substance misuse, are our biggest shared health concern. And then finally, people here need and deserve equitable access to services in their own communities as they age. So a couple examples of the information that got us to these conclusions for our top 5 priorities. First, local access to healthcare. 65% of the people who were answering this question told us that there were times their families could not get all the healthcare they needed locally in the last year. And 45% told us there were times they had to travel specifically to get an MRI. The survey asked for examples of the healthcare people could not get locally, and here are just a few of their answers. This is not surprising. There's definitely a lot to pay attention to here, though, and we of course are working to try and identify consistent solutions where we're able to bridge some of these gaps. Our second priority has to do with making sure that people have the information and the support they need to actually use the services we do have. And among the people who said their families did not get all the services they needed last year, more than a third said it was because they were over the income limit for the service they needed. 14% said they didn't know where to find what they needed. 12% said they were too embarrassed to apply for assistance, which kind of raises questions around stigma and how important it is to be really open and supportive when there's a service or something to support people with. And then 14% just don't think that what they need exists here. And maybe most, or certainly some of them are right about that. But when we actually do have help that's needed, we want to make sure we're getting people connected with it, and that it doesn't exist in a vacuum without people knowing it's there for them. So our third priority has to do with the pressure that people are feeling about the rising cost of, everything. And 2 out of every 5 people told us that their families had trouble affording what they needed in the community last year. Over a quarter of those who needed support said they weren't able to get all the help they needed. Among just the people whose families needed supportive services of one kind or another in the last year, this slide shows which services they needed. Half of these families named public insurance like Medicaid. About a quarter said help with utilities. A quarter said they needed local food assistance. A quarter said they needed state-sponsored food assistance like SNAP or WIC. About 15% of these families report needing help with transportation, and 14% need PMC's income-based financial assistance. So our fourth priority is to address this big shared health and safety concern around behavioral health. 46% of our survey respondents told us that their families needed mental health services of some kind in the last year. And now on a positive note, almost 60% of those who needed services said they were able to get them locally. But we all know that isn't necessarily spread out across all service types equally, right? So while the majority of services needed, over 80% were counseling or therapy. And then 45% of people were seeking medication for a mental health condition. And both of these are areas we have really been prioritizing building supports for through telehealth wherever possible, as well as on the ground. But on the other side, about 1 in 10 people needed one or more of crisis-related care, inpatient hospitalization, substance use treatment, or recovery supports. And I will say that while it's not on this slide, it was slightly less than these numbers. It's still very close for support with suicide attempt or completion. And these are services that are in different places locally for sure. So looking into which service types we have access to or don't is going to be a really important part of this priority. And finally, our 5th priority addresses the need for equitable access to the services and resources that are needed to enjoy healthy and thriving later years in Petersburg. Some good news here, with 81% of people surveyed saying Petersburg is a healthy place to grow older, and 3/4 of those who needed help planning for long-term care in the last year saying they were able to get what they needed locally. I will say, though, when our team dove into a crosstab analysis of some of that data, we noticed that the people who are more likely to describe the community as a very healthy one to grow older in were more likely to be pretty young. And by comparison of just the people who say that it's an unhealthy or very unhealthy place to grow older, almost 9 out of 10 of those people were ages 65 or older. So there still is a majority of people saying, great place to spend your later years, but there may be some clearer understanding and different perspective that really matters among people who are actually living that experience. So now we're going to take these health priorities that we've gone through a little bit and talk about the strategies our team is recommending and that we're asking the board to consider adopting tonight. So the strategies directly correspond to each of those priorities. Our first strategy is to increase availability of comprehensive healthcare services for our rural community. And I should say, I'm about to go through some slides that say how we'll do this. I know they sound pretty overarching without measurable components attached to them, but we'll get there. Our second strategy is to reduce barriers our community faces in accessing existing healthcare services. Our third strategy recommendation is to reduce the impact of rising costs on the community's access to health-related needs. Strategy 4 is support increased community behavioral health capacity and access to behavioral health services. And strategy 5 is to address and advocate for the health needs of our increasing elder and older adult population. So looking just at the first strategy, we broke this out into 6 different initiatives that can support actually contributing to achieving this. Obviously, establishing that new hospital and long-term care facility would contribute significantly, but also increasing availability of local screenings and diagnostic services, increasing availability of specialty clinics, integrating our telehealth partnerships into care across the board more broadly, and that, I will just draw your attention for a moment to the success measure. That doesn't just mean establishing a partnership. It also means making sure that people can meaningfully access it and know how a telehealth appointment is going to feel and maybe have some support walking through that. So these are some of the things we're talking through about how to achieve some of these things in a meaningful way on the ground. And then, of course, bridging gaps in perinatal care to support flourishing newborns and families in Petersburg. Of course, birth services comes up consistently in the interviews and the survey data. That'll be very clear in the report. And where can we bridge gaps that families are seeing there? Establishing career pathways to recruit and develop new providers, of course, is an important part of this as well, and especially growing our own, right? So as I move through the next 4 strategies, you might notice, so we've got our overarching strategy here, our initiatives that build up to achieving something under that strategy, how we'll measure our success, and then our role, whether this is really something that the hospital is driving forward, like say, trying to establish a new hospital, building up providers, these kind of things, or whether it's something where we're more of a partner with other folks on the ground. We have so many strong partners already in the community, and of course, there are many more that could be added here and will be. The one thing that I will say is going to be the same on every single one of these slides is the time frame. They will all say years 1 to 3. There wasn't any total strategy that we thought, oh yeah, we'll get that done in the next 9 months, no worries. So moving on, strategy 2, reducing these barriers. We're talking about increasing awareness of our services through messaging and through patient navigation, assessing the barriers that people have for different payer sources and finding opportunities to reduce those. Assessing the physical barriers to health services related to mobility, not just at the hospital, but throughout the community as people try to access services that may or may not be physically accessible to them. Monitoring patient perceptions of confidentiality and quality of care, which some people did share can be a barrier in accessing local care. It isn't always that the local care doesn't exist. Sometimes there is an experience that gives you pause, and we want to make sure that people know that's our goal, to resolve that and be the best care providers we can be. And then providing income-based financial assistance for healthcare costs. Our third strategy, reducing the impact of rising costs on our community's access to health-related needs. We are a partner in this. This is not something the hospital can solve on our own, of course, but we play a role in helping people mitigate how it's impacting their families by supporting local access initiatives to reduce food insecurity, by supporting local initiatives to increase affordable housing, such as formal participation in the housing task force if it's reestablished by the borough. Supporting local access to affordable childcare, of course, has been an important part of our work these last several years and continues to be, and supporting local access to healthy recreation. For our fourth strategy, which is supporting the increased community behavioral health capacity, again, we're a partner in this. We play a role in it along with others, and we support each other. It's a very interdependent area of care. And our initiatives under this would be to support increased local access to substance use disorder prevention, treatment, and recovery, support increased local services for suicide prevention and response, support increased local availability of crisis management, support increased community knowledge and reduce stigma regarding behavioral health conditions, to support, there's a gap, honestly, in the data we saw between people who said their families needed services and people who said they sought services. And so that's an important gap to look at. And then to support increased community access to healthy social activities, which are huge preventative measures in communities. Finally, strategy 5, addressing and advocating for the health needs of our increasing elder and older adult population. Our initiatives for this are establish services to meet the needs of older and disabled adults and their caregivers, assess barriers to services for older and disabled Alaskans in rural communities, and identify our opportunities to reduce those barriers, and to assess opportunities to expand services for a rural community. So these are both local, looking at what we can build, but they also really have statewide impact because in many ways there are policy restrictions or availability restrictions that are making it difficult to provide these services. So we're looking at that. That's why you see on this side here some more regional and statewide partners like AHA and SDS on that. So that was so much me talking at you, and maybe you have questions for me. I'm very happy to answer. Our big questions for you are whether there are any items on this proposed strategies list that you would like to change, whether there are any items you'd like to remove, and whether you're comfortable approving these strategies tonight. So thank you so much for taking the time to talk to me about this, and I'm looking forward to your questions, if there are any.
Questions?
The only thing that I thought of, and I'm trying to remember which strategy it was, actually it was reduce the impact of rising costs on our community access to health-related needs, but it could fit in a couple places. We've talked about doing the community health fair, and I think it ties into some of these things. It would be nice to identify that in some of our objectives here.
Thank you. Great point.
Any other questions?
Yeah, Jared, I have a question.
Go ahead, Joe.
Yeah, this is Joe. I guess, in looking through the strategies, like a question that comes to my mind, like for thinking, I'm looking at strategy 4, but I think for all of them, you know, approving these strategies, imagine a lot of this work is going to fall on the hospital and staff. I guess my question is in supporting these strategies, like, what are we committing to? Are we committing to increasing the staff at the hospital? Like I'm just take strategy 4, for example. Increase community behavioral health. Well, I think a lot of this is going to fall in the hospital. I mean, are we hiring more staff, more counselors? That's the kind of question I have. And I don't know, Katie, if that should go to you or to Phil or who, so.
Yeah, I mean, Katie, do you want me to respond to that, or do you?
Always, Phil. I'm happy to jump in as well, but
Yeah, I mean, these are, many of these things are already part of our roll-up into our strategic initiatives already. Many of these are things that we are in place. For example, we have our telehealth licensed clinical social worker, Pat Sessa, that's available to our staff, and for also, services in general. We have Ashley Kawashima, also behavioral health clinician, licensed clinical social worker. Bella works with the school. We have Abby Hardy that does care coordination, and then we have Dr. Sonkus who does telepsych. We're really well on our way to developing that. I would certainly love to see that increased and improve upon, but from an operational standpoint, it's in line. I don't necessarily think there would be add-on from a financial or staffing, like as part of a motion, but it's already part of our objectives. We have a lot of grant support that helped from like Kinderskog and mental health first aid training that we've done related to some of these. We've also incorporated a lot of behavioral activities related to our substance use within our medical staff. So a lot of these initiatives helps define and embed and weave them into our existing structure. And they are, other than the new hospital, which requires separate funding, these all are, I would say, it would give great direction to move those in place, but probably wouldn't cost, from an operational standpoint, a separate motion to approve related to a specific strategy.
Okay, thank you.
yeah, I should mention that one of the partners that I'm realizing really should be on this slide in particular is the Petersburg Community Foundation. I mean, just this week, we have 3 staff who, thanks to the foundation, are doing a training in an evidence-based, positive skills support training for being coaches for youth. And those supports will be embedded within the Orca camps, within Kinderskog, and within our school-based partnerships. So really, it sort of, I don't want to imply that we built this to show what we're already doing, because that's not the case. We really genuinely built this on the data we received from the community. But we received very similar feedback 3 years ago in the last assessment around behavioral health specifically. And that has been very useful in leveraging additional funds to build programs like the telepsychiatry program that, had a tough pilot year, but given the time and the funding to find its feet, it's been consistent and stabilized and supporting people. And we're able to say, hey, we're not just going after that on a whim or because a grant showed up, but because our community told us it was important. And that's one of the, the positive things of this requirement of checking in with the community in a formal, documented way. But your point is a very good one. I appreciate you making it.
What did you need for a motion on this?
So the IRS requirement basically says, here, I'll go back to that slide if the last couple times here we go. I ended up stopping sharing the last couple times I tried to do that, but hopefully you can see this one. So the requirement says that the governing entity for the hospital, in this case our board, must adopt the implementation strategy, approve or adopt the implementation strategy, to meet these identified needs on or before May 15th of this tax year. So to be honest, I don't know what you need, what is needed in terms of a motion, but we eventually would hope to end up with approval, maybe adapted, but approval of those 5 strategies broadly for the next 3 years, I should say.
I was thinking that it might be good to embed the motion, the bullet point of that, where it says the board has adopted an implementation strategy to meet the identified needs on or before May 5th. The board has adopted implementation strategy as indicated by the presentation. And Katie, do you think that we need to identify the strategic initiatives in that motion? I guess was one of my questions. Or 5 strategies, sorry.
You know, I don't know what's been done in the past, but whatever it was seems to have been compliant. So I think you could go either way. You could have a motion that lists those 5 strategies, or you could say the 5 strategies presented by the needs assessment team. I apologize. Robert's Rules of Order have never been my strong suit, so I am not the best person to answer that question. I just know that we need to have some sort of formal approval process before May.
Would anyone be?
This is Jason. I'd be glad to chime in, because some of this comes back to finance and we complete the Form 990 where we show compliance and all this. It would be sufficient to say we adopt the strategies presented this evening in this year's report.
Okay. Does anyone want to make that motion? Go ahead, Joe.
Yeah, this is Joe. I'd like to make a motion that the PMC board adopt the implementation strategies to meet the needs identified in the community needs assessment presented today on April 24th, 2025.
Second.
Second.
Is there any discussion? Is that a roll call or is that just a hands up? Just okay, all in favor?
Aye.
Aye.
Okay, thank you.
Thanks for the life on that, Jason, and thank you very much. I appreciate your time.
Thank you for that report. Moving on to next meeting, it's shown here, May 29th, 5:30. Do I have a motion to go into executive session?
That we go into executive session to discuss the legal matters, medical appointments, and reappointments.
I'll second.
Second.
All in favor?
Aye.
Gotta step out for 1 second.
Thank you, everyone.
Leave this one, Jim, and then I'll meet you on the executive session one.
Yep.